Well, if you are on Medicaid right now, a first alert to a new Nebraska rule impacting your coverage. Retroactive Medicaid coverage is now protected in Nebraska after a bill passed through the legislature today. First Alert 6's Zina Taher explains what that means for you. Zina?
Yeah, Aaron, to explain, retroactive coverage essentially allows Medicaid patients to have their medical expenses covered up to 3 months before their application date. So it's meant to help patients who might have an emergency before they're actually covered by Medicaid and before they apply. A bill passed through the legislature today, and it makes sure retroactive coverage stays in place. It's in response to an effort by Nebraska's Department of Health and Human Services to shrink it. DHHS asked for a 5-year waiver to limit retroactive Medicaid eligibility. Patients without retroactive coverage would only be reimbursed for medical episodes in the same calendar month they applied for Medicaid. Advocates say that would put some patients in a tricky situation.
Schedule your emergency accordingly. So try to get that emergency in at the first of the month. Otherwise, if you come in at the end of the month, that time frame is condensed to get the paperwork in.
The governor's office could still veto that bill, but the Nebraska Hospital Association isn't expecting that to be a barrier. Even if it is, the organization says there's still enough time in the session for legislators to override that veto. Keep in mind, even with this bill's passage, changes are still on the way for Medicaid patients. President Trump's One Big Beautiful Bill cut the current 3 months of retroactive coverage to a maximum of 2 months. That change is going to kick in 2027, and it's going to affect patients in the state. In the studio, Zina Taher, First Alert 6.
Thanks for breaking that down for us, Zina.